I am Yang Fong son. I was born in China, went to pre-med in University of Michigan, and went to school, medical school in University of Michigan. Before I finished medical school, actually in medical school, I did some research project. I did a research for a cardiac pharmacologist. Around that time, I met my husband, who was working on his PhD. He's Caucasian, and Stephen Holtzman. And we married before we finished school. And he found a job. Actually, several places offer him a job. And one of the places is Emory University. And that was a very firm postdoc job. And we have to have a match, medical school match. So for a couple, professionally, you don't find a job is very difficult. And luckily, we get an interview. We met Dr. Steinhaus in anesthesiology department in Emory, and I was able to talk to him for, actually after he talked to me for 2 hours, he said he had 2 internships already filled, but because I have very good background, I did a research in university when I was a medical student, and I got an award from Michigan Heart Association, and he said, you know, I'm very interested to have you. If you put me as the first priority to come to Emory, and I will open a position, the 3rd position of internship, just for you. So luckily he did, and the rest of the history. I was intern and a resident, and we rotate all in different places. We work in Grady, we work in VA hospital, we work in Children's Hospital, and of course the Emory Clinic is always there somewhere. And but that time, since you were intern or resident, or you don't really think about that until I finished my residency, and I did a year of fellowship because I wanted to pursue some research in anesthesiology. And so I was able to take a fellowship under the vice chair, Dr. Fredrickson, and published some papers. And then Dr. Steinhaus come to me, offered me a job to work in Emory facility, Emory, you know. And at the beginning, I thought that work at Emory you become, you know, associate assistant professor. Then eventually, you know, you follow the rank, go up. And the next thing I find out, if you are faculty, you also work in a place called Emory Clinic. That's how I find out. But I was a resident for 4 years, yeah, plus fellowship. And so I finished my residency and the fellowship, and I was offered a job they call associate, like an instructor level. And shortly I was promoted to the assistant professor. So that's how I get started. Then I get to know Emory Clinic. My husband probably heard of Emory University. That's why he applied job here. Uh, 1973. Yes, I heard the story, but didn't pay much attention then. You know, you say you work, you know, if you come to be a professor, not be professor, come as a faculty member, and you automatically work with the Emory Clinic, Emory Hospital. And, but at the beginning, I don't know that difference from, you as a junior faculty, you only pay attention, you take care of the patient and try to learn to do some study, learn to do teaching, or things like that. And you don't pay much attention about the relationship at Emory Hospital, Emory Clinic, or Emory Clinic for the rest of the university. You don't really pay much attention on that. Yes, I know Dr. Hurst and Dr. Bruce Lowe very well. Dr. Bruce Lowe is a very interesting individual. He always liked me, and whenever you see me, you usually pick me up. I mean, he's not very tall himself, and he always called me little, hi, little one. Yeah. And Dr. Hurst, actually, I took several months medicine during my internship. And one time, I and Dr. Steve Clements, who is my chief resident then, and we met by elevator, and he said, you are coming to take a residency of medicine, right? I say no. I say, I was promised by Dr. Steinhaus I will take residency in anesthesiology, because he offered me called rotating 8 internship. We rotate with 2 months medicine, 2 months pediatrics, and the rest of 8 months is the anesthesiologist. That's the internship. So he said, why not? I say, well, that's my interest. That's why I came down to look for anesthesiology residency began with. Some years later, he needed surgery, and I was the chief of outpatient surgery, and he came to me, he said, Dr. Sung, he said, I need to have some procedure done. Would you take care of me? I said, of course. And after the surgery, everything's fine. And so I say, aren't you glad you never make me your intern? He just laughing, and he gave me a nice couple of books. One book, he and his grandson written together. That was very interesting. Book about money. I read it, but I can't remember it. It's all green, yeah, that was. He's a good writer. He wrote a lot of cardiology book, things like that. He's a very interesting man, and he's very kind, very successful, and in clinic work as well as educational work for his resident. And I wish that time I decided to be a medical intern, I would have very good education by him. But I spent 2 months on his service, on their service I really enjoyed. I had a good time, yeah. Dr. Brown was the one. I think he's an oncologist or something. Can't remember. I never really had much contact with him. Sam Wilkins, yes, he's also interesting faculty. He, when I become we have a lot of interesting story together. Dr. Wilkins, they call him Crying Sam. I don't know whether you know this or not, but he's very believing in high quality care, and a lot of times he will complain to the chief of anesthesiology or things like that. And when I just become faculty, and he told me, he said, I had an encounter with him because he had a patient. He said, what I'm going to do is I'm going to put you get a patient ready. I'm going to put my finger in, then I put the endotracheal tube in, things like that. So I say, no. I say, I'm the physician. I'm the one put a tube in your patient, inspired, because a lot of his patient has deformed the airway, had a radiation therapy, does most upper airway malignant procedures, and he's very good. And so I told him, no, I'm going to put a tube in as soon as we're ready, the patient ready, after the patient had an induction done, everything done. So he was not happy, and that time I was a junior faculty, went to tell my senior faculty. He said, who's that little nurse there, and tell me I cannot do anything I need to do. They say, oh, Yang Fong is not a nurse. She's a physician. She's newly hired faculty, and she's tough. You better do whatever she does. But anyway, so that was beginning our encounter. But later on, many years later, all his patients had difficult airway. He always come look for me to take care of them. So that was very nice. Not only that, his daughter used to be PA, and she decided to become an anesthesia resident. And she and I, we become very good friends as well. She's an anesthesiologist practicing in town. Seems very complicated, and it's very, university seems not very happy with the Emory Clinic, because the Emory Clinic has a partnership. And after a few years, I work as a faculty member, and I was elected partner. That time, like 3 or 4 years later. I can't remember how many years now. But anyway, so I was a partner, and one time, that time Emory has a place, you have a faculty for dinner in the House Mill House. You on weeknight you can go there, and to order dinner, things like that. I happened to sit with a lawyer, and we start to chat, and my husband and I, we both on faculty here, so we both had a dinner there. And he found out I was a physician in Emory. He jumped on me. He was say the very nasty words to me. He said, "You guys take all the money. You think you support us. You don't. We work too." Something like that. Not very, very kind. So finally, I and my husband had to walk away. I have a feeling around that time. Although as a junior faculty, Emory. Clinician in Emory, they brought a lot of income in, and they support the rest of the university. They take care of the university for other department, other school. And so the university, the rest of faculty in different school, they are very angry in a way at the Emory clinician. Seems you make a lot of money, you think you support us, which probably is true, because we make a lot of money, and we support the university and make a university more progress, more advanced. So eventually, Emory will call the Harvard in the South. So I think that's very nice. I think Emory Clinic did a good job to support the university and to make a university to be such a well-named college, or the school, not only school of medicine, and a school of a lot of other areas, and it's very well-named. Now Emory is well-known in the country, especially when I did the research. I went to report my research work, and they all know about Emory. So, which makes me very proud and very happy to see that. Yes, that time, I think I already was junior partner, I already was a partner. And 1978, I was, think I almost in process to become associate professor with tenure. My chairman made me that time, later on, made me to become associate chief to start a hospital, so-called surgical specialty group for anesthesia, anesthesia for surgical specialty, that group. And so I was associate chief, I was director of anesthesia surgical specialty, which take care of, let's see, taking care of 14 operating room that time, including 2 urology, and the rest 3 rooms for the cardiac group. That time cardiac specialized, that was 1979 starting, but it just things to start, because what I did is in 1975, I and some of my colleagues, we find that there's a lot of problem in neurosurgical patient, because neurosurgical patient you have to be operated on when you're in sitting position, and there's a lot of air, getting to your vessels, so it's very dangerous for the patient, and so sometimes patient come out, they mental status going to change, or sometimes they have a problem. But anyway, so I and a few colleagues and went to our chairman. We say, neurosurgery really need attention. Can we just form a group, do most of neurosurgery, because you do day in, day out, and so what's the problem is, you can avoid all the complications. Not only that, you can start to train the younger resident or fellows or things like that. And so Dr. Steinhaus was very supportive. He said, yes, go for it. So he made me as called director of neurosurgical anesthesia. And at that time, we have a neurosurgeon came in who happened to be Dr. George Tyndall. And he was a very good surgeon, and sometimes get stressed. But because we have a good group work with him, and so he was very happy. And that was a beginning of subspecialty lines of the different anesthesia group. Just starting. So 1979, I was become chief for the one called surgical specialty, do all the neurosurgery, vascular surgery, some even thoracic surgery. And the other group has like a 3 operating room, they do open heart all the time, bypass, to the coronary disease, which is headed by Dr. Kaplan. So he and we are both associate chief under Dr. Steinhaus. He's a chief of anesthesiology in Emory Hospital, as well as the chairman. And I was associate chief, and so Joe Kaplan. It's very nice. You got to see all the, it's a good celebration, and you got to see all the, that time, the partner, I still think a partner was very good. Everybody's like a brother, sisters. And we, because we celebrate the success of Emory Clinic, and we celebrate, how not only success in the patient care, we're successful in education, we're successful in financial, success as well. So there was a very good celebration, and you got to meet all your friends and the partners in medicine, in surgery, in different area, and had a big party, had a good time. My research is, when I did a study in Michigan, then I was going to do a basic science research. Then I did a year fellowship, and because my husband, I did mostly cardiac research, and my husband is a behavioral pharmacologist, and he does most neuro behavior type thing. And so because we discuss a lot during our dinner time, and if we can have a same language, so I decide, since I didn't want to join cardiac group, which I was invited, and I start with the other group, which I start the neurosurgical area. So I decide I do some area for neuroscience-wise. So when I was in trained in 1 year fellowship, I published a paper in ASA, and I got a second place of the residency paper in American Society of Anesthesiology. And then I come back, I was thinking about doing more basic type research. Then I realized Emory Clinic doesn't really support much research because you have to work clinically in order to pay yourself, financially. So I start to get it. I always interested in pharmacology because I married a pharmacologist as well. So I start to interested in clinical pharmacology. So what I did is I tore my direction to a clinical study. I did a lot of clinical study. I did for induction agent. For example, propofol or Diprivan. You probably heard the drug, right? Which killed Michael Jackson, which is in the wrong hand. But we did a study. I did a many of a study before it went to FDA, be approved by FDA. And I did a lot of other study, like short-acting narcotics intravenously, and also I did a study for antiemetics. And so I brought in a lot of grants. Mostly the grant is from the company, so have a nice grants and to do the study. And from phase 2 to phase 4 study I did, and finally eventually a lot of drug approved by FDA. And another thing I forgot to mention is during my residency, because when I was growing up in China, my uncle, not only is a Western physician, he also, during Second World War, he learned to use acupuncture to treat the patient. For example, when he had a patient, he had a outpatient clinic, which is downstairs of his house. He has a big building in Nanjing. And when I was in elementary school, I spent every summer with him. And he taught me, actually I was a little technician as well. He taught me to test patients' urine, okay, to check a lot of stuff. Not only that, he for example, he treat pneumonia in outpatient wise. Patient come in with a fever, chest pain, and he give them a shot of penicillin. Then he gives some acupuncture to ease their pain, and then send them home and take the pill. Ask them to come back visit. Next couple of days or things like that. So I learned a lot of things from him, and I learned acupuncture from him. So when I come here in the States during my residency, 1972, Nixon visit China, I think, brought back a lot of information about acupuncture and everything. So everybody say, oh, acupuncture is going to replace anesthesia. I say, no, it will not, But who's going to listen a little resident, talk about, we're not. So finally I say, well, in that case, I'm going to apply grants to do acupuncture. I think acupuncture is only going to help the pain relief. And so I got a grant. That's probably the first grant NIH ever give to complementary medicine. So I got a grant, and so I started to study in VA hospital. and for dental patient, and which come use acupuncture with 4 group, when the placebo plus placebo, and the placebo plus acupuncture, and placebo acupuncture plus the drug, and then acupuncture plus the drug. So the 4 groups. And finally, I find out the best group is acupuncture plus the drug. They have a synergistic effect. And the placebo, none of them work. So that was the NIH grant I got. And so I did publication in 1977 in Anesthesiology Journal. I think that was the first journal, anesthesiology, first complementary paper is published in Anesthesiology Journal. So I was very happy for that. I guess so, because I don't see many other Asian faculty in medical school, especially female. And although for practice anesthesiology, you are in a little cocoon, you live in the operating most of the time, so you don't really see the other area. But I don't remember see any Asian physicians when during the faculty meeting or during the executive committee meeting or things like that. I was on executive committee meeting because I was the associate chief, was in the clinic in executive committee meeting. So I really didn't see many Asian around, and especially female. I think I was the first female Asian physician in Emory Clinic.
Okay.
Well, I think clinic is really, really important. They support the university. I think you cannot. We had a few so-called grandfather's club. Some private practitioner come to Emory Clinic to work when I was resident. I remember that. They are not on faculty, but eventually, the time I become faculty, all people working in Emory Clinic, all physicians working in Emory Clinic, have to be on faculty in university. So you have a joint appointment, so that's how we start. I think that's mainly Emory Clinic really support the university, not only support financially, also support them in faculty point of view. How early? Charlie Hatcher is one. A lot of nurses, I know a lot of cardiac nurse, they've been here for a long time, and I know a lot of nurse for neurosurgical intensive care a lot, and some I even bump into once in a while, and they also hug me, because every time after the patient after surgery, I usually go make rounds in the evening or a couple of days later, just check how my patient doing. And so I get to know a lot of nurses in both cardiac, in both neurosurgical anesthesia, surgical intensive care. My greatest accomplishment is I become one and only female tenure professor in my department. My department started in 1958. It's almost 60 years of history. And my regret is that I didn't see any followers in my department. None of the tenure female faculty, tenure professor, or in my department follow after I left, after I retired. In 1958, there's a newspaper published about Grady hospital had a lot of patients died because of anesthesia. And since Dr. Steinhaus took over, and he he's a pioneer in anesthesiology as well. He was trained by Dr. Waters, and he and Dr. Fredrickson, they both were trained by Dr. Waters. They believe anesthesiology should be safe for the patient to go through the surgery. So our department really accomplished that. My chairman, he trained most anesthesiologists some years back, most anesthesiologists in the city, in the state of Georgia, and even some out of state. The reason I know is when I try to prepare my chairman's 90 years birthday, I invite a lot of former residents back, and they all practice all around the state, in different states, and train from Emory. So my department is really had a lot of accomplishment. I'm so proud of and the department is getting bigger, and now we even had a female chair. So she's the first female chair in our department, which is hopefully will keep on progressing. Oh, I have a lot of favorite stories. A lot of surgeons, when they beginning, they don't know me. A little woman dressed like a rag lady, because the scrub looks pretty bad, and I have a stethoscope in my waist, and running around in a mask, running around, and very short, until I bail out the patient for them, because I walk. In the hospital, I walk, when I was associate chief, I was chief of the surgical specialty, was the associate chief of anesthesia for the hospital. And I walk like 5 miles every day to watch every room, be sure every room's in good order, all patients safe, and they all, have no problem. And then in 1984, I starting there's ambulatory surgery, because the ambulatory surgery started to develop. And Dr. Steinhaus asked me to go to cross the street, start the ambulatory surgery in Emory Clinic, which is, I was the founding director of ambulatory surgery. And then we started geriatric anesthesia in Wesley Woods. I was the founding director there to treat the patient, his depression patient. We do the shock treatment for them, which is you see their progress, it's very good. And later on, of course, started executive park, orthopedic surgery for orthopedic. Then before I retired, I started GI in Emory Clinic. So I started out of those areas. And at the beginning, the surgeon looked at me and said, "Oh, you're a little woman, you probably don't know much of things like that." And until they got in trouble, I helped them out. And eventually, I earned my respect. And they really start to like me, and they respect me, and especially patients with a lot of airway problem. And I think there's one guy, he's real big. I think his name's McDonald. No. He's an ENT surgeon. He's big, he's 6 feet tall, And one time he had some procedure in ambulatory surgery, and he said, "Whoops." If a surgeon say "whoops," that's bad news, So I usually say, "Well, you probably should go out talk to the family. We'll take care of the rest problem, And he's like a 6'4" or something. He said, "Yes, ma'am." I mean, that was really funny. Eventually, all surgeons will, respect me, because I believe anesthesiology and the surgery are a team, and the nurse, all three entity is a team. We have to work together for best patient care. So whenever surgeon has a very sick patient or very they know there's a problem to manage patient, they usually come to me and say, I want you to take care of the patient. I say, okay, if I do that, you got to stay there all the time, not just come in and resident, to open up for you, and then you leave, resident close up. You have to stay there the whole time, and they listen. So that's all my story is that. And also we had one surgeon who wrote a lot of books, but he's not a very good surgeon. He tried to learn a lot of things from resident. How did Dr. So-and-so do that? And he wrote a book which made him famous. So they took him. Eventually, he was rejected to become partnership. He left Emory Clinic. One day, he come to sitting in my office. He told me, he said, the surgeon is captain of the ship. I told him, I said, no. If you were captain of the ship sunk. And he turned red because he didn't know how to do surgery. He didn't know how to take care of the patient, So finally, he was rejected by Emory Clinic partnership, and he left. So, we believe, Emory Clinic, we believe we have to have a good patient care. We have to take care, watch each other, take care of things, And so my department always say, if the faculty has a problem, send to Fong. She'll get rid of them. I don't know, later on, I don't know why the chairman didn't want to do that after Dr. Steinhaus left. And if we find some resident is on drug, they couldn't catch him, they send to Fong, she'll catch them. And I caught quite a few residents on drug and I put them in rehab. So you have to keep your eye open and watch your patient, and take good care of patients. So make a clinic is very advanced, very good patient care place. Therefore, you make Emory University famous as well. A lot of, like this time, Emory had an Ebola treatment done, and Emory has a good name around the world. I still have a lot of hope for Emory Clinic. We should have, we had a lot of physician leaders, and Emory Clinic, now we have a new leader, and I think physician should have take the part of leadership, and the manager, the business part of you have to work with the physician who knows medicine, who does research, who take care of the patient. And so not just Emory Clinic is the place to make money. Talk about making money. When I was a medical student, before I go to medical school is a noble profession. You treat patient regardless you get a pay or not. You work hard, you work 24 hours, the most I don't have sleep is 37 hours, because that time that's old days, now you don't do that anymore. And we work for the patient. Patient is most important in our life, in our career. If you don't take a if no we're patient, we don't have Emory Clinic. We don't need a physician. We don't need the nurses. So Emory Clinic should work for the patient, take good care, best care of patient we could, and so eventually, and we're going to be well known as well to make a university well known. Old days was nice, and I had a good time. I have no regrets what I done. I enjoy what I did. I enjoy clinical practice. I enjoy my research, which drug all come out now, we're using now. And I say, oh, I did a study on this drug, I did a study on that drug, you know. And I taught my residents, so whenever I go to the society, our residents all come hug me and say hi to me. And I was administrator. If I go back to my former office, and a lot of older nurses, they were there before, they knew me, they always come give me a hug. So I had a great time, and I enjoy what I done, and I'm having a great time to retire too. So now I can travel around the world to see the world, and especially to see China. I was there about end of March, beginning of April, and I visited many places. And I was there last year ago, May. I was there a year ago, November. So now I'm going to China more often since I do have a spare time now. So I like to, I must say, I know America, I know Europe more than I know China. Now I'm going to learn more China.